The bill was really about trying to reduce the cost of prescription drugs to seniors. And who could argue with that as a goal, right? It's something that everyone that's a senior would be concerned about. And so there are provisions that would curb the out-of-pocket costs. But like anything, there's always unintended consequences. And what we'll talk about today is what are those unintended consequences and how is an agent going to need to be prepared to educate and communicate.
So Dwane, we're back for our next installment on some of the Inflation Reduction Act, Medicare disruption, all the things going on in the Medicare industry right now. So welcome back. I've got Dwane McFerrin here, Senior Vice President of Medicare Solutions for SMS. Dan Trumbley, Director of Communications and Creative Services. So good to see you again, Dwane.
Yeah, thanks for having me back. You know, there's a lot of drama, and this story is not finished on the CMS final rule, plus the complications that come with the Inflation Reduction Act. So today we'll cover those in a little more detail, and hopefully everyone learns something new. Most importantly is, how do I plan for the future?
Yeah, and so the topic today we're going to take a little bit deeper dive in is the Inflation Reduction Act. We touched on it on a prior video, but it was only about 5 minutes, and we just kind of gave a high level. But today we kind of want to go into some of the nuances, a little bit more detail, give agents hopefully some answers to a lot of questions that they probably have. So I guess the first question I have is, what is the Inflation Reduction Act, and why is it so important right now?
Well, it's a $750 billion bill, so it doesn't sound like it's reducing inflation at all. It sounds like it's contributing to the inflation that we have as a country. And it's one of those omnibus bills where they throw a lot of things into it. So you maybe have a smaller bill that doesn't get approved on its own merit, but it might get linked to a bill like this. So a lot of this Inflation Reduction Act is related to climate change, which is kind of a stretch to tie that back to reducing inflation. So most bills in Congress, they get a flowery name to make it sound good, but it doesn't necessarily mean that that's fully descriptive of what it does. One of the implications of the bill was really about trying to reduce the cost of prescription drugs to seniors. And who could argue with that as a goal, right? It's something that everyone that's a senior would be concerned about. And so there are provisions that would curb the out-of-pocket costs. But like anything, there's always unintended consequences. And what we'll talk about today is, what are those unintended consequences and how is an agent going to need to be prepared to educate and communicate, because it sounds great. It'll make great television. There'll be announcements on how we negotiated drug prices and we put a cap on your out-of-pocket and we made insulin more affordable for those that are affected. But in the end, someone else is going to pay the price. And that's where the agent comes in, is we need to educate but not scare seniors, but there are some unintended consequences that's ultimately going to affect about 39 million, seniors that are on prescription drug plans, and over 50 million that are part of some kind of a Medicare Advantage plan. So it's a change for sure.
Yeah. So let's dig into some of those. You mentioned some of the provisions, and there's a lot in this bill. I think you had told me at one point how many pages this bill was. I don't remember.
It's a light reading, 1,300 pages.
Yeah. So there's a lot in it, and everything from climate change to manufacturing things. There's some things about ACA subsidies in there even as well, I think. But we're going to focus mostly, for our agents, on a lot of things that affect Medicare and Part D in particular. So we put a few of those up here, and I think in a lot of ways it's really almost remaking how the Part D plans are structured, right? So what are some of those things, like eliminating the coverage gap, the max out-of-pocket limitations? Like, what are some of those really key things that agents need to be aware of?
When Part D came out about 18 years ago, it was a $250 deductible. And some carriers would actually waive the deductible on the Part D plan. Now we're approximating or approaching $600 as just the deductible alone. And then you have the actual copays that a senior would face. And you can see you go into a pharmacy at the beginning of January, and you could be facing a pretty daunting bill. And so there's been proposals that have now been enacted into law that would put a cap of $2,000 on that senior or on the really Medicare beneficiary, because they're not all seniors, right? But it would put a cap of $2,000 for those that are on insulin. That was done last year, and that's at $35. And then there's the intent to negotiate drug prices. And so 10 drugs are high cost drugs are being addressed in 2026. Unfortunately, I wish it would have been this year, because it would have made a lot more sense. When a senior or a beneficiary receives their ANOC letter in September, they're not getting the benefit of any negotiated drug prices that perhaps CMS or the government has been able to do with manufacturers, not until the future. So this year, what we'll see is that cap come down to $2,000, but someone has to pay for that additional coverage. So right now, or the additional exposure, right now that rolls to the carrier.
Right.
So just like any other business, when the prices go up for the manufacturer, then it's going to get passed on to the consumer. And that's really what we're anticipating. One way or the other, there's about 39 million people affected that are going to see increased prices on their Part D. Medicare Advantage plans are not exempt from that. Mm-hmm. And so there's quite a bit of exposure. So before we had a deductible, plus then you had the initial coverage limit, and then you had a coverage gap. Well, now the coverage gap kind of gets wiped out. And it's just the initial coverage limit, and the deductible will add up to $2,000. And after that, it's the obligation of the carrier to take that risk. So we've already seen some carriers pull out of the market, saying they were barely making money, if at all. And now, they can't see how they can actually make money. So we've seen some plan exits already from carriers. We should expect to see increased premiums that will come about. And we'll know, probably after August 4th on what that will be. But so here's a chart that would show currently in 2023 how this works. And the carrier, the obligation really kicks in around $3,100. But with the changes in regulations for 2025, it's after $2,000, that coverage shifts, or that risk shifts to the carrier. And so now the carrier will be obligated on the claim side. So how does the carrier mitigate that? Well, could they change the formulary? Could they change the network of providers? Could they increase the premium? There's a number of things that a carrier can do to say, I'm going to absorb in some way this additional risk exposure. So we do expect change, and we think it's going to be pretty substantial.
Yeah, so a lot going on this chart. And so maybe you can let me know if I'm reading it right, and maybe let our viewers know if I'm reading this right. So what I'm seeing here is, what really stood out to me was obviously the coverage, the out-of-pocket limit starting earlier, right, at $2,000. But then this light blue right here, that's the Part D plan's obligation, right? And
that's the carrier. Right?
Yeah, the carrier's obligation. And so it was really striking to me how much more obligation the carriers are going to have after that out-of-pocket limit is met, right? So that's what you're saying, is a lot more on the carriers, but ultimately that cost is going to get passed to the consumer.
Right, and those costs carry through not only on a standalone Part D plan, but they're also embedded in a Medicare Advantage plan. So the cost to the carrier is going to go up. Now, carriers were already dealing with morbidity changes or on just the health insurance side of things, and they didn't get the reimbursement rates that they were hoping for. So you have the confluence of a couple of factors that come into effect. Ultimately, the exposure of the carrier to additional risk that they're going to have to find a way to manage. Now, they can change benefits, they can change premiums, and they're probably going to try to do a little bit of both for 2025.
Mm-hmm. So I think this next chart just kind of shows some similar information as the last one, but just maybe a different view of it, right?
Right. In the blue, you see the 2024, how the plans worked, and how the members' out-of-pocket maximum was affected. And so you can see in the coverage gap, the member had exposure. The senior would have exposure. But in 2025, that member exposure goes to zero because it's all pushed onto the insurance carrier. And that's what they have to manage to.
Mm-hmm.
In addition to the changes on the out of pocket, there would be more eligible individuals for increased subsidies, for low income subsidies. So that helps control the cost. So there's a portion of our society that really benefits from the Inflation Reduction Act. And we'll look at another slide here. We'll say, well, who pays, right? And how many people benefit. So let's take a look at that. Okay, so here's a chart that says back in 2021, so it's a little out of date, but back in 2021, 1.5 million individuals went beyond that 2,000 out-of-pocket exposure. So those people stand to gain. Now, if you measure it over a 10-year period, we had approximately 5 million people that exceeded that, at least at some point, that $2,000 exposure. But that means they're all going to benefit. About 1.5 million per year would be the approximation. However, 39 million people are going to be paying for it, right? They're going to be subsidizing the 1.5 million. So that's how it will kind of balance out, is those that are not necessarily heavy users of drugs are essentially going to subsidize those that are heavy users of drugs.
So a couple minutes ago, you mentioned about the drug negotiations. So they're starting with a limited number of drugs next year. So what are some of the details of that agents should be aware of? What are they looking? Can you say what drugs they're looking at, or what the timeline is?
Congress has announced, or CMS has announced, I should say, what drugs they are trying to negotiate. So they have identified those 10 drugs for 2026. And they're high-cost drugs, which is a good thing. The problem is that they started in 2023 with saying we're going to select those drugs, but they really doesn't have an impact until 2026. So 2025 will be a unique year because you don't have the benefit of negotiated drug prices for these expensive brand name drugs, but yet nevertheless you've got the impact of the Inflation Reduction Act on premiums while you're seeing lower claim costs. So it is kind of interesting. I wish that they would have timed it differently and started negotiating drug costs earlier. Then it would have made a lot more sense. So for 2025, it's going to be an unintended consequence. The timing is going to show a lot of seniors when they get their ANOC letter in September. Wow, my premiums really went up. And my formulary, the drugs might have shifted from, say, tier 2 to tier 3. So now I have co-insurance instead of perhaps co-pays. So there will be some shifting for 2025. But I think some relief is on the way in future years as some of these drugs, expensive drugs, get negotiated. I think that it's not just for 2026. It will apply in 2027 and 2028. So additional drugs and even more drugs have been selected. And those are some of the highest cost drugs that seniors face for a variety of ailments. So I think the intent of the Inflation Reduction Act on prescription drugs is really noble. The timing, though, is going to be awkward and it's going to be difficult. In an election year, seniors are going to open their ANOC letter and see maybe some sticker shock this year. And they're going to see benefits reduced on Medicare Advantage. And so 2024 will be the best year that we've had in terms of benefit design for seniors. And for 2025, I'm expecting other changes like perhaps extra benefits being lowered. Perhaps maybe dental won't be 5,000 coverage for benefits, but maybe it will be 1,000. We could see formulary changes and premium changes. So there's a little more flexibility on Medicare Advantage on how many levers, if you will, a carrier can pull to try to absorb the impact of the Inflation Reduction Act. But on the standalone Part D, there's only a few levers. And so with that, I'm just expecting some significant change. Probably one of the biggest changes that I anticipate is the basic plan. The basic plan is likely to go up in premium substantially, but a carrier is also, with the CMS final rule regulations, is being told that there's another $100 in compensation. And I would be highly doubtful that a carrier can do both. that they can offer the basic plan at an attractive price or reasonable price for a consumer and pay $100 more to an agent. I would not be surprised to see a lot of the basic plans go non-commissionable for 2025, just like we saw last year with one major carrier that did that. I would expect others to follow suit in 2025.
So you kind of alluded to it just now, but just to kind of put more of a point on it, Medicare Advantage is going to be impacted by it. You know, if it has Part D coverage built into it, is going to be impacted by all these same things. And so do you see Medicare Advantage plans potentially going, you know, away from the zero premium and doing some drastic changes in the
That's a
plan
really
designs?
good question. I think the carriers will do everything they can to hold on to that zero premium, but I wouldn't be surprised, and we've already heard of some plan exits and some, they call them service area reductions. I wouldn't be surprised to see a lot of that this year, where carriers saying, can we really make a plan attractive to a buyer, or should we exit? So the morbidity alone is a factor. The reimbursement rate is a factor. The Inflation Reduction Act and the impact on prescription drugs is a factor, and the CMS regulations on compensation, they all come together, and it really creates change. And I would expect that the carriers are trying to figure out how to absorb that, and how an agent reacts will be different. So an agent could be recommending a plan where they don't get paid a commission in 2025. And that's really unfortunate, because the whole intent is to give consumers choice as well. But if an agent's not paid, it's going to be difficult for an agent to spend a lot of time on drugs. And so with that, they're going to need tools. They're going to need to find efficient ways to help people without it being a real drain on their time. And that's really where senior market sales comes in.
So we've hit some of the high points on what's in the Inflation Reduction Act that's going to impact these plans. What are some of maybe the nuances that agents should be aware of, or maybe are wondering about? I've heard about this smoothing provision. You know, are there things like that, or what would you say about the smoothing provision that
one of the, thank you, Dan. One of the aspects of the Inflation Reduction Act was you still have sticker shock as a beneficiary. You go to the pharmacy January 2nd and you're facing a deductible. Perhaps you're facing a very expensive drug, and you could get to your out-of-pocket limit of $2,000 in January. And how many people right after Christmas, especially, can afford that? So with the Inflation Reduction Act, there's a smoothing provision that would say you could spread out that cost over the balance of the year. And so you're not taking a $2,000 hit all at once. Now, how that works with each carrier is yet to be announced or yet to be determined. I'm expecting a variety of solutions, not a standard solution. Perhaps we will have a standard solution, but it's yet to be presented to us. So right now, if I'm a carrier and I also am a retailer, I might have a different process than if I'm a carrier and I have no tie, my business doesn't tie back to the retailer at all. That might be a different process as well.
Mm-hmm.
A carrier also has to assume that some of those, the reimbursement might not get collected. So that's like a new factor in pricing, and how much of the time do you spend as a carrier chasing after the unpaid bill is kind of like a new risk as well. And, you think about as you're an agent or a carrier, you're trying to collect, the agent won't be involved, I'm sure, but the whole idea of there's a claim and, but there's some of the payment that's been made that needs to be collected from the consumer. And that's just a new risk, a new challenge, something an insurance carrier is not used to doing.
Yeah, it kind of just fits into this whole theme you've been weaving throughout this of the intended outcomes and then the unintended outcomes, right? So the intended outcome is good, of trying to protect consumers from these huge catastrophic, claims. But then the unintended outcome is the carriers have to figure out how to deal with a new wrinkle, right? And how to actually administer these things. And they're probably all going to do it different. So it creates challenges for all of us.
The headline is 2025 will be the most disruptive year we've had in Medicare since the Part D and the Medicare Advantage plans came about. And for a good reason. There's many of these factors that come together to make this the most complex situation that we've faced in decades.
Yeah, so let's look at some of those things that are really going to challenge all of us. This, AEP, even leading up into AEP. You've kind of touched on a lot of them throughout our talk here so far, but maybe just let's just focus on them a little bit here. I mean, you've mentioned potentially higher premiums, lower benefits, formularies changing. I mean, just what are some of the things that agents really need to be thinking about that their clients are going to be seeing in these letters, ANOC letters coming out soon, that we want to make sure agents are aware of?
Well, probably most important is while we're anticipating change and we're planning for change, there's only so much we can share with the beneficiary at this point, right? We can't talk about the benefits for 2025 until October 1st. We can't talk about their premiums, but we can educate them on the Inflation Reduction Act because that's law. And so we are working on a variety of materials that would help an agent explain what's happening without scaring people. And that's a balancing act. We don't want to talk about, we can't predict all the benefits and the premiums. We certainly can't, even if we have a first look document, we can't share those with someone. But we know the Inflation Reduction Act is going to have a profound impact on our business. And it would make sense for an agent to get started early. I would expect that every client that is an agent's book of business, if they read their ANOC letter, they're probably going to be calling. So that would mean an agent would be well suited to go ahead and plan for that in advance. So let's look at some of the expected outcomes. We think the average consumer is going to pay much more. I've heard some cases double, even triple what their premiums were in 2023, or 2024, excuse me. So when we talk about sticker shock, that's what I mean. It's not like a 10% increase. It's going to be substantial.
And I've heard you talk about how potentially your Part D premium could potentially be as much as your Med Sup premium.
It very well could rival. And so now you think about it, let's say you have a $130 Medicare supplement premium. What if you imagine you had $130 Part D premium? Can a consumer afford $260 a month? Will that lead them to Medicare Advantage plans, which also are going to be degraded in terms of their benefits, but will that make a Medicare Advantage plan more attractive? So Part D will be a factor. And that's in terms of just affordability. And there will be a segment of society that can't afford it. And what's really unfortunate is there are a lot of consumers in rural areas. Medicare Advantage isn't even an option. They're just looking at higher premiums. So as an agent, you might want to start thinking of, well, is it G and always G, Plan G for Med Sup? Should I be looking at N? Should I be looking at high deductible G? Should I be taking high deductible G and pairing that perhaps with a hospital indemnity plan to help offset some of these new costs that are affecting a consumer? So as an agent, you really want to look at your portfolio and say, am I doing the right thing for my clients? Especially in rural areas where Medicare Advantage option may not even be available. Might have to get a little more creative to help people be wise with their money. So some of the changes on Part D, you can see formulary changes. Last year, we saw some Tier 2 drugs become Tier 3. So they went from copay to coinsurance. That's a real possibility. Premiums, definitely we talked about. Well, we've always talked about almost every carrier has 64,000 pharmacies in their network. How can everybody have 64,000? But it seemed like that was the case. We could see a thinning of pharmacies this year simply because trying to make the plans more affordable, keep that premium down. On Medicare Advantage, we're expecting those extra benefits to really be degraded. And so you think about it, an agent has gotten used to enrolling people and talking about their utility bills. They're talking to them about their a round of golf, maybe a robotic pet. How about groceries? I mean, some of the things we've talked about have gotten so far away from the need for health insurance, and it was really merchandising. But if those extra benefits are like what I'm expecting to be degraded, then the agent will really be back to talking about why people would want to buy that Medicare Advantage plan. They're going to focus on the out-of-pocket costs and the premium and making sure their doctors in the network and the traditional things that we've done. But we may see a real de-emphasis on those extra benefits simply to be able to retain that zero premium plan. So seeing a lot less of the challenge between carriers is they seem to keep one-upsmanship on extra benefits. And this year, I think it will be muted. How much? We'll see.
Yeah.
Yep.
So I want to put a plug in for a future webinar we want to do, because you mentioned how, agents can try to communicate with their clients about this and let them know some of the things that we think are coming. So we are working on some communication materials to help agents do that. And we are going to do a webinar just on that topic, I think, in the future here, where we'll talk about some of the do's and don'ts around communicating and be able to point agents to some of the materials that we're going to create to help them with that.
Well, if you're doing Medicare workshops,
Yeah.
you're going to want to have this be a heavy part of your education.
Yeah.
Because it really does represent profound change in how the program is designed.
Yeah, and so we're gonna make some additions to our existing Medicare 101 workshop presentation, and I know everybody wants to get started on this stuff right away, but we got to get this stuff through compliance and make sure it's all good to go. But we're working on it as fast as we can.
I've been in the industry now for more than 40 years, and when I broke into the business, we were using phrases like, "Are you aware of the changes to Medicare?" And it's amazing that 40 years later, we're still saying the changes to Medicare are what would generate a response, would gather consumer interest. And in the years where we've had the most disruption is when we've seen the most sales success. So I do expect this to be a robust year in terms of sales, but it will be because of change. And so it depends on how you look at life and you look at businesses. When there's change, is there opportunity? Or when there's change, there's, sadness and depression, right? We don't have a choice. And insurance agents are used to change and embrace change, pursue change, but get started early would be my recommendation. Is get those appointments scheduled, find self-service and self-help tools. That's what you're really going to need. And that's really where senior market sales comes in.
So that's a perfect segue, because we wanted to maybe talk about some of the tools that SMS has available to agents. So perfect segue into some of the tools we have with Lead Advantage Pro and Medicare Insurance Direct. So when you talk about this being potentially an opportunity for agents, the agents who have the most successful AEP are going to be the ones that have the most efficiencies built into their business, right? So how do you get in front of the most clients and have the most appointments to be able to go through all these changes with your clients? So maybe talk a little bit about some of the tools that SMS offers.
For years, there's been a lot of challenge on quoting and enrollment. There's been no shortage of competition. There's a lot of tools out there that do quoting and enrollment. But really the secret this year for 2025 is not only have quoting and enrollment, but have time-saving elements that would create the ability for an agent to service their entire book of business. So Lead Advantage Pro and Medicare Insurance Direct are both belong to senior market sales. And we've thrown a lot of our innovation into our tools. And we were doing quoting and enrollment with Lead Advantage Pro well before the pandemic, before quoting and enrollment electronically became, common for all agents. We were already there, and we've led the way in terms of innovation. And now the innovation that we have is really about saving valuable time, and we'll cover that in just a moment. Medicare Insurance Direct is more of a consumer-facing tool, whereas Lead Advantage Pro is an agent-facing tool. So they're both powerful. What I'm excited about is we can now say that they're linked. The data are integrated. So if a consumer is acting on Medicare Insurance Direct, that data will go into the quoting and enrollment and the time-saving platform of LA Pro, and vice versa. So now you have two tools. So if the consumer wants to see it, you use Medicare Insurance Direct. If the agent needs to really plan and support that consumer, they're most likely to use Lead Advantage Pro because it's got so many powerful tools. But now they're linked. And now we're even integrating with external CRM systems like Agency Block, like Salesforce, like Zoho. So pretty exciting that we're now working with external systems. Maybe these external systems are really good at commission reconciliation or drip marketing. You don't have to choose. We now integrate. And so these tools, Lead Advantage Pro and Medicare Insurance Direct, are the best in the industry. You'll find tools and functionality in our tools that you won't find anywhere else.
Yeah, and I think some of the more recent innovations we've had in Lead Advantage Pro, it's almost like we were predicting the future in some ways on trying to make the Part D review and quoting and enrollment process as efficient as possible for an agent and as easy as possible for the client. So things like the client portal where they can go in and actually enter their drugs and update their drugs. So the agent doesn't have to do all that data entry. And then, like you mentioned, the Medicare Insurance Direct, the self-enrollment piece and all that being linked up now. So our goal is to make, AEP and Part D in particular as efficient as possible for agents because they've got, in some cases, hundreds and maybe thousands of clients that they have to touch.
Yeah. Imagine you've got 2,000 clients and they're all wanting to call you as soon as they get the ANOC letter in late September and schedule a meeting. You'd be overrun. And so how have agents handled Part D in the past? Perhaps they've hired a son or daughter or a temp to go out and collect drug information, manually enter that, and it's still time-consuming and costly. With our self-service feature, we now have the ability for you to mass email all of your clients at once, essentially, and the clients to go out and actually enter their drug information, which includes more than just a drug, but their dosage, their frequency, the pharmacy that they go to. And now we've created reminders to help that consumer remember to do it. As we introduced it late last year, we were getting 50% of a book of business that would do the self-service feature. And now we're introducing self-enrollment on as well. And if you've got non-commissionable plans, you want to spend your time efficiently. So if you can have self-service on the drug collection information and the client can self-enroll, but you remain agent of record, that's a pretty effective way to do business. And so now we have the ability for you to send a link for the consumer to enroll on the plan that you recommended. So now with our tool, you can spend your time on solutions, on what the consumer needs, not so much on collection of data. And then a lot of that data carries over right into the app, including the provider. So for an agent that's looking to save time, I can't imagine that you'd find a tool any better than what we have.
So maybe to sum up a little bit here, a lot of change, still some uncertainty, still we've got to see the plan designs come out. We see what everything looks like, but it sounds like from what you're saying, from change always comes opportunity. And really for an agent, this is an opportunity to reinforce your role as an expert, as somebody who's there to help your clients. You can be there to help your clients understand all these changes and help them make sure they're in the right plan this AEP.
Starting early is a key, and use tools that make you efficient. But if you're waiting for the client to call you, you're probably going to be overrun this fall. So start early. But of course, make sure that we're educating them on change, not scaring them, and not overstating what the benefits and premiums will be, because that's not allowed either. So finding a balancing act, but be prepared, schedule those meetings, use the tools to where a client can serve themselves and enroll themselves. And we're finding more and more seniors are willing to do that. So that would be my encouragement. Talk to your favorite marketer, call our number, fill out a form and say, I need to talk to somebody. But if you're not using time-saving tools, you're really ill-prepared for 2025.
And so a lot of agents might be wondering, okay, I need to talk to somebody now. I have got more questions. I want to learn about these tools that can help me. So what should agents be doing right now if they've got more questions? Calling in their marketer at Senior Market Sales. We'll put the phone number up on the screen here so they can see that. They can go to seniormarketsales.com, our website, and fill out a form to have somebody contact you. If you're watching this on a webinar on Zoom, we'll actually put a survey up here at the end so you can actually indicate if you'd like somebody to reach out to you there. But is there anything else that you would recommend an agent could be doing right now?
Well, if you go to seniormarketsales.com and you register at My SMS, and you'll find that in, I think, the upper right-hand corner, is get behind the login page. If you're only on the main page, you won't get the detail that you really need. We actually have recorded webinars, so you can actually see the tool in use and how some of the functions are performed. You can also call and talk to a marketer, and they can either share with you a recorded video or they can walk you through what you really need to know. But get engaged with those tools. That'd be what I'd recommend that you do right away. We know we're going to have marketing materials coming soon that you'll be able to educate your consumers that are going to be compliant. So you're going to want to look at that inventory of material that we'll have. And we have a brand folder. Once you're working with Senior Market Sales, you can get to the brand folder. We call it Client Stream. And with that, you'll find a variety of material that you can use to educate your client and stay within compliance. But I say talk to your marketer. Make sure you fully understand the power of our tools and that you can apply that to save time. And I really like the reminder feature when you ask for a client to do self-enrollment, but we've sent out reminders so that we can get you to 50%. But imagine if you could eliminate half of the time that you're spending on drug lookups, how valuable that would be. So to me, it's not how much do I get paid, but rather how much time can I save so I can get to the next client. That's the burden of each AEP. And most agents will say after each AEP, they collapse. And that's in a normal year. So this year, I think they really need to plan ahead and to do it in the month of July. Don't wait until September.
Yeah. Well, thanks so much, Dwane. I always learn a lot whenever we cover these subjects, and hopefully our agents learned a lot as well. And we'll be back for more. We'll probably do another one of these on the CMS regs here soon and kind of update what have we learned on that, what's the new there. And like we mentioned earlier, we'll have some more webinars on some of the tools and resources that are available to agents.
Well, thanks for attending, and call me as well. I'm more than happy to take your call. We have a great business. We have a wonderful business that's growing in such a big way. 12,000 seniors a day are turning 65, or 12,000 people are. What a great business to be in. But you have to be fleet of foot, you have to be efficient, and you have to have the right tools. And really, that was the purpose of today's webinar.
Yeah. Well, thank you very much. And thanks everybody for attending.
Thank you.
We'll see you next time.